All right, Dr. Mangum with Primary Healthcare is joining us today, and he's going to be teaching us about how to live a healthy life. Thanks for joining us.
Yeah, absolutely. I'm excited to kind of be here, and thanks for the invite. Yeah.
This is going to be really good. So when it comes to, how long ago did you start your practice?
So yeah, I'm an independent physician. I have my own practice, and I started about three and a half years ago. So after long training and traveling all over, we kind of settled here in Salt Lake Valley, and I practiced at another clinic for a little bit, and then started my own practice. So
starting your own practice is a lot.
Yeah.
And there's a lot of aspects you've got to learn. Before we talk about setting up your own practice, what got you into medicine?
Yeah, so that's kind of a long story. We'll kind of truncate all that, but essentially, I was a nursing assistant, a CNA, and I was working at the hospital, University of Utah Hospital, in neurology and neurosurgery, and just kind of getting my feet wet and trying to figure out what I wanted to do. I was trying to figure that out. And my brother, who's a massage therapist, a lot of people don't know this, but my brother was a massage therapist and said, "Hey, I'm going to go to chiropractic school. You should come with me." So I actually went to chiropractic school, graduated from chiro school, and practiced with my brother for about a year and a half.
I didn't know that.
Yeah.
That's exciting.
Yeah. And then I actually went back to osteopathic medical school. And then did a family medicine residency and actually a sports medicine fellowship at Boise State. So I do like a combo practice of primary care, orthopedic sports medicine, and family medicine.
That's really cool.
Yeah.
I think that gives a lot of your patients an advantage because they're not seeing a primary care doc who is more just internal medicine, right?
Yeah.
And super needed, but a lot of primary care doctors have to see people who are like, my back's hurting and I can't figure it out, or my neck's killing me, and knowing where to refer, whereas you might be able to better assess that.
Yeah, about 25% of primary care visits per year statistically are orthopedics, related.
Yeah.
My back hurts, my neck hurts, my shoulder hurts. We rely a lot on the physical therapist to kind of help us out with a lot of that stuff. But as kind of a non-operative orthopedist, sports medicine doc, and a family medicine doc, a lot of my patients really like that aspect of, I can come to you as my general doctor, but then, hey, I also have shoulder and knee and hip and back and, all that stuff. So we kind of help them out there too.
See, I think that's really good advice for any of the doctors who listen to our podcast, that maybe they should take more training, right? Like physical therapists, just speaking from my experience, we get out there and then we're like, I just treat pelvic floor, so they just take those courses. It's like, well, what if you took a dry needling course or maybe a lower extremity course so that you have some more understanding in that area? But it sounds like you layered it. You've got chiropractic school, DO, sports medicine, primary care.
Yeah.
Like you're layering this so that you're a bigger asset, maybe have the right answer sooner, right?
Yeah. Well, I think part of it, I got to tell you a little story here.
Yeah.
Part of it is I love to learn, right? And I think everybody kind of has their journey in life. And my journey wasn't just like straight med school and that's it. It was, oh, we're doing this and we're going over here. And oh, I really like this. Oh, and I really like that. So I've kind of done quite a bit of training, and it was funny. So I did undergrad chiro school, which is, 3 to 4 years, depending on how fast you go through that. Then med school, which is another 4 years. Family medicine residency, 3 years, and then 1 year sports med fellowship. So I've been like in school for like 16 years.
Yeah. And all of that before you turned 28.
Yes. And my son, I came back from school, dad's school, to be a doctor. And my son was like, I think in like 5th grade or something. And we were having dinner around the dinner table, and he goes, "Dad, I don't think you're very smart." And I was like, oh, okay. Like as a 5th grader, he's like, my dad's still in school. And the only people that go to school for long periods of time are the people that like get held back, that kind of like struggle. And he's like, "Dad, it's okay. And I'm like, oh, wait, elaborate here, and he goes, well, I don't think you're very smart because you're still in school and you're like an adult man.
That is awesome.
So we kind of had to like talk about, so when you get done with high school, you're just barely starting, bud.
Yeah.
Like you're going to have a lot of more training and years
a lot of
training.
opportunities for it too.
Yeah.
That is hilarious.
Anyways, that's kind of a fun story.
I love that it comes out though.
Yeah.
Like it's so good he said it instead of just thinking and telling his friends, My dad's so dumb. And it's like, actually, your dad's one of the smartest.
He's super smart, actually, and he's read a lot of textbooks.
That's why he's still in school. That's like, did you hear the story about the main singer on Linkin Park? His daughter was like, I'm gonna learn to play the guitar for the talent show.
Oh, okay.
And he goes, well, let me give you some advice. And she's like, it's okay, Dad, I got this. And then goes to the mom and is like, what is Dad trying to do? He doesn't know anything. She's like, let me show you a video. She didn't even know he's like the head singer for Linkin Park.
Really?
And I'm like, oh, I love that. But kind of cool, like that she didn't know.
Yeah.
Like, I don't know.
Yeah.
That's cool that, and probably inspiring for your son too once he realizes.
Yeah, and I think that's kind of, as a fifth grader, you just, you're trying to understand the world, right? But it just speaks to the aspect of like, I think to be a really efficient healthcare provider and to really do a good job and be the best in your kind of what you do, you gotta continue training, I think, and just constantly read and study and update your mind. And I mean, it's the pace at which, medical research and education is like growing and expanding is like exhausting to kind of keep up on. But I think as healthcare providers, we all kind of need to have that oomph to like, okay, what else can I learn? What else can I do? What else can I know? And so
well, and it's really easy to forget stuff too if you're not utilizing it all the time. Mm-hmm. And one of the best ways to utilize it is to restudy it. Yeah. Right. I think as healthcare providers, we need that, but the general public, too often when it comes to living a healthy life, people are like, hey, I finished school, I'm done, I check out. Yeah. It's like, no, what's the next step? What's the new way you're learning, right? The schooling system has its pros and cons. I have strong feelings about it. But one of the cons is that people think if it's not structured, then I stop learning. Yeah. And to live a healthy life, we need to keep learning, keep our brain alive, and that can help with Alzheimer's and dementia and stuff.
Absolutely.
So in your practice, other than learning, what do you teach people to live a full, healthy life?
Yeah, that's a really complex question. There's so many variables to that. I think basically, part of like what I do is obviously is general medicine and trying to really have people live a healthy life. And I couple that with my sports medicine, kind of background too, of like, I think our body is like this instrument to our mind, and we need to have a body that can really experience life to the best that we can. I think out of the gate we have genetics, and whatever you kind of get, Yeah. And so some people are limited by that, or some people are really enhanced by genetics. And so whatever your kind of basis of playing, so to speak, we just kind of take that and how do we optimize that? How do we like get your genetics, your baseline to optim as best as we can, right? So that's kind of my mindset when I see patients. I'm always trying to optimize their health the best way I can. And then life choices, sometimes people have life choices that kind of set them back or enhance them. So, we kind of work with that. But day in, day out is, something comes up with our body. Okay, let's try to fix this. Let's try to optimize this experience so that we can like get you back playing, get you back doing what you love to do, get you back living your best life, right? Yeah. And so some of the ways we do that is annual wellness visits, right?
Is that something everybody should do, or only the people with illnesses?
That's the
question I get asked all the time.
That's like such a good question, right? My personal opinion is that if you're like, especially as you're growing up through your kid years, your pediatric years, yes, you should go see your pediatrician or your family doc like every year. I think that's very appropriate, very wise. to
Catch things early.
catch things early. And then from like 20 to like 35-ish, I'm kind of like, yes, per guidelines, we need an annual wellness
Right.
every year, but it's probably okay if you're like feeling good and you have like good genetics and you don't have any like major illnesses or conditions. You could probably get away every 2 to 3 years. But the thing is like, I love doing blood work every year on folks, right? And so you don't really know what the internal organs are doing unless you evaluate those,
Yeah.
right? I feel good.
Yeah.
You know,
cancer is not something that you gradually notice.
Yeah.
It's something that it's suddenly there.
Come
but your
on.
blood system, those tests can tell you that sooner.
Yeah,
right?
especially if you're genetics, right? So getting an A1C, screening you for diabetes,
Yeah.
checking your thyroid, checking kidney, liver electrolytes, checking all your blood cells, cholesterol, right? We know that cholesterol is like a cumulative thing, right? So familial hypercholesterolemia, someone that has a genetic predisposition to high cholesterol, doesn't really know that until we get the labs.
At what point can you find those things out? Is that early
Early
on?
20s, yeah.
Early 20s?
Teenagers, yeah.
Okay.
And so we screen for that. And then we like, oh, to be honest, you'll be surprised. A lot of people have high cholesterol.
Yeah.
It's probably from a diet of the American
The
society.
American system, yeah, unfortunately.
You know, but we want to know that because cholesterol will start plugging your arteries over time. And then it's not until you're, 50, 60, 70 that you get the heart attacks. Well, dang, we should have been kind of helping you in your 20s, 30s, and 40s.
Whether that's with diet, exercise.
Exactly.
Or sometimes medication when needed.
Yep.
That's one of my favorite things. Sorry, total tangent
go
here.
ahead.
But I was talking with a doctor right out of PT school.
Mm-hmm.
And he said, every patient, when he gives them their medications, he's like, hey, here's the poisons I want you to take. And here's the benefits we're hoping to get from those poisons. And here's the negatives we're hoping to avoid.
Yeah, exactly.
And I was like, that's a really good way of putting it.
Yeah, it's such a balance, right? So it's like, okay, well, I don't want to take pills. I don't want to take pills.
Yeah.
Okay, well then you live your life.
Yep.
And then when you get big problems, then we'll do big interventions.
Right.
And we'll try to salvage, your function and your optimization of health, right? But a little bit of pill, we do a pretty good job at knowing these pills and these meds. And yes, there's side effects and dosing it.
Yeah.
But the benefit outweighs the risk. That's always in our minds as physicians of like giving you this drug that's abnormal. It's not part of your normal physiology and nutrition stuff. But it does such a great benefit for folks that it's like, it's probably worth the risk.
Yeah.
Because no one wants to like have a massive heart attack or a stroke in their 50s and 60s and be like, ugh, now I got to like live the next 20, 30 years with some pretty good deficits, right?
Yeah, so, and you hear from all of these people from other countries.
Yeah.
And their dad back home died at 52 because he couldn't get a simple medication, It's like access to these medications is life-changing.
Yeah.
Right? And something simple that can obviously live a healthy life, right? Exercise more, eat healthy nutrition, try to get this stuff that has less preservatives, right?
Yeah.
That makes a big difference, but sometimes a simple medication
can be helpful.
Yeah. Life-changing.
But baseline is diet and exercise. Like have to diet and exercise. Yeah. And by diet, I mean healthy food choices, right? Whole fruits, whole vegetables, lean protein, easy on the carbs.
Yes. Especially American carbs.
Yes, all the good things in life you have to like be easy on.
But dude, when I travel, the carbs feel so much better.
Yeah.
I wish we had better carbs here in America.
Yeah.
That seems to be a problem. Other than checking in with your doctor, getting these blood tests so you kind of know what's going on.
Yep.
Diet, exercise, drinking enough water. Mm-hmm. Is there anything else that you recommend and you help people recognize early on? Yeah.
And so for the exercise component, again, as like a sports med doc, I'm obviously super into exercise. We recommend 150 minutes of moderate intensity exercise.
How do they measure that moderate intensity?
So that's the key, right, is moderate intensity. And you can get in the weeds on moderate intensity and all this stuff and VO2 max. And,
Zone 2 training.
Yeah, exactly, But my threshold for most of my patients is like, I'm just starting to sweat, starting to breathe a little hard, heart rate's going up. So moderate intensity. And you can do 75 minutes of high intensity, which is like the cardiovascular benefit that's the same or analogous to the 150 moderate intensity. But the high intensity, what happens, sometimes people get hurt. So like, especially if you're not like an avid exerciser.
Weekend warrior.
Yeah. And then you're like, hey, we got to like go do this crazy workout and like run and jump over all these crazy things. Then if you're not used to that, you can get hurt. And then that sets you back as far as your health goes, or can. So we just recommend 150 minutes of moderate intensity. Just start to breathe hard, sweat, break a sweat. And it's what I do is encourage everybody, just do what you love, right? If you like hiking, you go on a hike. If you like cycling, you cycle. If you like swimming, then go swimming. You know, whatever you love to do, because exercise has to be rewarding for it to be like a lifelong thing, right?
Yeah.
And sometimes you're really into CrossFit, and sometimes you're into cycling, and sometimes you're into skiing, and you know, it's just kind of, that's the benefit of living in Utah. I think we just have so many great seasons and so many sports we could participate in. So
yeah.
But exercise, I think moderate intensity is kind of a good way to start. And if you want to do high intensity, just warm up to it, so kind of prevent some injuries. But if you get hurt, we'll rehab you and get you going again.
Yeah, exactly. We'd rather prevent the injury, but if it happens, then let's get going. I think that's the barrier that holds a lot of people back, is they're like, well, if I go on a walk, it's not really doing anything. Yeah. So if I'm not going to take it serious, why try? Mm-hmm. It's like, dude, a 30-minute walk is fantastic.
Yes, so amazing. Even if you do low intensity, that's better than nothing.
Yeah, and you said 150 minutes, that's per week?
Per week, yeah. 150 minutes per week.
So 30 minutes walking a day adds up pretty quick, right? Mm-hmm. And can be an easy entrance. People, I was young and naive, right? 22 years old. I worked at a call center for Finland. It was great. And there, several people there would go on walks during their lunch break, and I'm like, you weirdos, you idiots. Why are you wasting your lunch break, right? And I'm this 22-year-old. Now, I was playing basketball and soccer 6 to 8 hours every Friday and Saturday, right? And so I was out there moving. Mm-hmm. Now I get it. Yeah. These were 35-year-olds, 40-year-olds, and I was like, oh, that's why. Yeah. Like, just get out and walk. Just get started. Lower that barrier to entrance or to entry into moving. Mm-hmm. And then, like you said, get to that point where you're just sweating a little bit, breathing a little bit hard. You're like, man, I breathe hard when I jog. And it's like, good, that's enough.
That's good, yep. And the more that you do it, your body gets used to it, adapts, and cardiovascular efficiencies, start to kick in, and it's pretty amazing. But yeah, another thing I wanted to follow up with is that's kind of the 20 to 30, and then you get into your 40s, 50s, 60s, 70s, 80s, and on. Then we start going into a lot of the cancer screenings. Okay. Right? Yeah. So at 45, we start colonoscopies for women. We start doing mammograms at 40, pap smears, cervical cancer screens, starting actually at 20, but depending on what type of exam you do, can dictate like how often you have to do the cervical cancer screening.
What about like mammograms, for example? I've heard from, this is not my wheelhouse, right? I do physical injuries. Yeah. But I've heard from some patients who had questions on that, like, do I need to do that every year or every 5 years, or how often? It's because I've heard different guidelines, but I've heard different doctors say it's actually, you don't need to go that often. Yeah. What's your advice on that?
So I wish there was one national standard per every guideline. Right. But it's the OBGYN Association that says this, and then the United States Preventative Task Force says this, and
the AMA says something different.
Yeah, so there's all these guidelines. We kind of have in our heads all the guidelines, but we take each patient individually. So
that's smart.
Each patient comes in, I say, here are the guidelines. Let's review your family history. Like, what do you want to do, right? Like, if they have strong opposition for cancer screenings, for example, then I try to
less often.
Yeah, try to do it less often, but I still try to get in, as much as we can. If people
especially if they have family history of these type of things.
Yeah, my mom, my sister, grandma all died of breast cancer. Oh, wow. So we're doing
Yes.
annual
Yep.
mammograms, and we're doing cancer screening, so we can actually do some blood work and figure out what cancer risks you have.
Yeah.
And then we can kind of individualize treatment based on kind of what they're bringing to the table. So to speak.
Are there other things like age where you have to do it more often, or if someone's overweight or inactive?
Yeah, so age for sure. And so we take everyone's age and we'll do those cancer screenings based off age recommendations and guidelines. And then as far as like you said, obesity and exercise, what their exercise level is. Not a lot of guidelines change with that.
Okay.
But definitely I'd want to know the labs, right? Like why? Well, obesity is a big part of our practice because it's a big part of our culture, right? And so we have a lot of tools in our tool bags to help with that, right? And we know that obesity is a major cardiovascular risk factor for heart disease, for activity level, for joints, back, knees, hips, ankles. So we can be really aggressive with weight loss and be really efficient. I had just one quick story. I had a patient that lost over 130 pounds, and we helped him with that. And he was like, if you weren't my doctor, I would literally kiss you right now. And he's like, you have changed my life, completely changed my life. And he's a 50-year-old man. And he's like, there was no way that I was ever going to get out of this body. I was stuck. I was stuck. 150 pounds. I can't exercise. It hurts so bad.
Yep.
And I can't live my life. I can't play with my kids. I can't go on hikes. I mean, I'm literally I work and then I come home and it just hurts too much to move.
Yeah.
And you lose 150 pounds of your body weight and you're like, whoa, I can move. I feel better. I can get up out of the couch. I can get in my car better. I can start being more active.
Get on the ground and play with your kids.
Completely change his life. Absolutely. Yeah. So I'm so into, let's be happy. Let's be healthy. Let's do annual wellness visits. If you have a problem with your body, come in. Let's get you taken care of. Whatever you have, let's see if we can optimize you to live your best life. That's really what we do.
What I'm hearing you say is that there are treatments that you provide, but your job is as a coach. You're coaching people to, here's the guidelines here. Let me show you what your test results show on your blood screens, and let's optimize your whole life.
Yeah.
What are your goals? What is the lifestyle you would live if you didn't have this extra 150 pounds?
Yeah.
And anybody who's struggling to understand it, right? They're like, oh, come on, it can't be that hard. Just go walk, right? Throw on a 150-pound backpack and then go walk.
Yes,
right?
And see and lay down and then try to sit up with 150 pounds and
do it for a week.
Yeah, I mean it's just crazy, Yeah. And so we can really help a lot of people, and I love doing it, and that's why I chose to be a doctor and a physician, and I finally found what I really love, and I love helping people, and I love getting them to really just be active and enjoy their life, and it's great. It's very rewarding.
I've got a kind of side question, but as a clinician, how do you handle or approach situations where people aren't following that advice?
Yeah.
Because that's got to be hard.
Yeah, it's super hard. It's super frustrating, right? And it's funny when people, sometimes they'll come to my office, they'll call and make an appointment, then they come in, pay me money, I give them advice, nah, I'm not going to do that. Okay. You do you. You do you, and that's totally fine. And maybe they just wanted to hear a professional opinion about something.
Or it takes 2 or 3 different doctors saying it before they'll listen.
Thing. Yeah. And then also, a lot of people, the internet has changed the way people patients interact with their physicians, because ChatGPT said, I put in my MRI, or I put in my lab results, or I put in data into this ChatGPT, and it says blah, 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 blah.
Yeah.
And so I have to, as a physician, I have to kind of know my stuff. So I'm always learning. 2 is I have to take that information and that situation and that like
Mindset.
the mindset
Yeah.
that they have and work with that, right? And so you could just, nope, that's not how it is, and but then the people aren't really receptive to that.
Yeah.
So you kind of have to like play a little psychology game and figure out where they're coming from and be tactful about kind of really recommending stuff. But at the end of the day, it's their choice, it's their body. If they don't take my advice, then they'll come back in 6 months or a year and be like,
when it's gotten worse.
I still have this problem,
Yeah.
or this is an issue, and then we'll just kind of deal with it, right? I don't know everything, but I know a lot.
Yeah.
So
Well, and all those layers of schooling makes a big difference. But when I graduated, forever ago,
yeah.
it was Dr. Google
Mhm.
that I was up against,
Mhm.
and now it's Dr. AI.
AI, and it's actually really smart. It's getting really good, to be honest.
Yep.
And so patients are very educated. They're very informed. With our practice, we do kind of middle class and upper class a little bit. And so they're pretty smart people, like with college degrees and professionals. And I mean, they're informed.
Yep.
And so it's they come in with some pretty tough questions sometimes, and so
which is great, and I love the access, but people need to realize that they need to put the information in correctly, and not skip details, and realize that the answer is very generic, right, and sometimes inaccurate. So we've got a question. I didn't warn you about this, but we asked this to everybody right at the end.
Okay, here we go.
Good luck.
Yeah, all right.
So we love to ask, what does a mint condition life look like?
Mint condition.
The podcast called the Mint Condition Podcast. So what does a mint condition life look like? Yeah,
and I think we've kind of just naturally went over that. And so my response would be, a mint condition life would be someone that's like living their ideal life with a body that's working the best that it can based on what life has given you, right? And so I hope you're happy. I hope you're doing the things you love to do. I hope you're successful in taking care of your body and having your body really have you optimize your life experience, right? And I think that's my job as a physician, is try to help people do that. And so annual wellness visits are great. Exercise, diet, that's the basis of everything. Sleep is super important. We do a lot of sleep stuff just because, you're anxious about your job. You have life events that are negative that you're like, oh, how do I deal with this?
Doom scrolling.
So what?
Doom scrolling.
Doom scrolling.
That's what stops a lot of people from sleeping.
And so, trying to really work on sleep, eating healthy, exercising, different facets of your life that are can affect your health. So, and then genetics is a big part, right? So family history of diabetes, everybody gets diabetes. It's just something we're going to have to deal with. So don't let that bring you down. Don't let that derail you too much. Let's optimize that with treatment options. And so that's what I love about family medicine is anybody has any medical problem, just come see us and we'll figure out what we can. And if we can't fix everything, then we get you to a specialist, to a pulmonologist, a cardiologist, whatever we need to do. I like that a lot. Like, live intentionally is what I'm hearing you say. That's great. So you said people can come and see you and get that baseline help and guidance if they need to see specialists. How do people find you? What's the best way? Website, phone number? So we're primary healthcare. Super intuitive.
Just Google primary healthcare. This will pop up. Primary healthcare,
Utah, Dr. Mangum will pop up. Our website's www.phcmed.com. We're on the internet. You can search me, Dr. Kevin Mangum. Pull up my website, make an appointment. We have convenient online scheduling. You can schedule your own appointment.
That's awesome.
You don't even need to call the office, and then just come in. And part of the reason we didn't really get into that a little bit, maybe we could do another one, but I'm independent. And the reason why I chose to be independent as a practice is I don't want to have any restrictions on how I take care of my patients. And it's really great because we're kind of like a mom and pop shop of healthcare. And so if the big corporations in town scare you and you get lost as a number, come here. We do mom and pop healthcare and really individualized treatments for folks. So it's fun.
Yeah, I think that'd be really good. We should do another episode about that individualized care compared to maybe what they get
Big
somewhere
box
else.
medicine.
Yeah. That's awesome. Well, thank you for coming on.
Yeah. Well, thanks for having me.
This was great.
Yeah, absolutely.